Okay, thanks for your patience there for a little while. We're just waiting for everyone to join in. We think most participants have joined. So I want to say a big welcome to those who joined us participating in the panel. We're gathering here for World Mental Health Day 2020. And as I've just mentioned, I'm in CC The Works, who are co-hosting. So I want to say thank you to them for doing the technical side of gathering us all together, and the continuing technical side of this online meeting. So if anyone wants to learn more about CC The Works, their information's online, but it's about new ways of collaborating and thinking about connectivity in the community and creativity. So I won't take too much time. I'd like to open it up to the panelists to talk about themselves for a little bit. So about 5 minutes each to introduce yourselves, about your work in the community, and supporting mental health. So I'm going to go to who's in line on my my screen. So I've got Nick first. So hi, Nick. Nice to see you.
Hello. Hopefully you can hear me. So are we just going to introduce ourselves? Yes. So
yeah, just yourself, the work you do, and how you began your work to support the community and mental health.
So I will keep this quite short. My name's Nick Bradshaw. I work at the World Innovation Summit for Health, WISH, which is an initiative of Qatar Foundation here in Doha. And we've been going for a good few years now, but this, of course, for everyone is a whole new way of doing things. We're going to be having the summit of our own, big summit next month, which I will say straight off, you're all welcome to join, wish.org.qa, free, at which what's important for us is we always have a mix of physical health issues, but always incorporating mental health and actually spiritual health as well. But mental health is really important, and as part of a holistic approach. And I suppose my background, I was a journalist for a long time, working particularly in health and mental health, in particular within that issues, doing a lot of men's health, working in men's lifestyle magazines and other magazines and newspapers in the UK, the US and Ireland. And I feel very at home in WISH. I feel strangely at home this year that the topics that we're covering are about global health. And unfortunately, global health is a major focus this year. But I think what I'm really pleased that I get to do is I get to meet some fantastic people who I can just absorb knowledge from. And the knowledge I've got has been showing the innovative ways that people are looking at health, looking at mental health. We in the community at WISH this time last year, held a few art therapy sessions. We had a speaker who will be having again next month for our summit, Giles, who's a photographer who lost 3 of his limbs in a war zone and is a great kind of inspiration, who will talk about his physical challenges, but also the mental challenges that he's had. And I think we're all learning a lot from that. I mean, we did an exhibition last year where we featured some drawings from Rohingya refugees. And these young refugees, they have very little way to express, especially when we're talking about children, how a child is meant to express the trauma that they've gone through. And actually, art has been their way to do that. They draw things, they can then talk about things. I mean, I'm aware that I'm talking about this with people here who are art therapists who absolutely know the value of that. But as somebody from outside, seeing the value that has been great to be involved in. So I'm really excited to be part of this panel. I won't say too much else, but hopefully just as a conversation develops, I'll speak up then.
Thank you, Nick. I think that brings us nicely on to Michelle, actually, who's the next
great. Yes, a very complimentary, Nick.
Yeah, so it does blend.
Hi everyone, my name is Michelle Dixon. I work at Sidra Medicine in Qatar. I've been working there for roughly 3 years now, just under 3 years. So I've had about 10 years experience as an art therapist. I've worked a lot across different hospital and medical facilities. So my specialization's really been in oncology and chronic illnesses. So it definitely, art within a hospital environment gives children choice. It sort of normalizes their experience and they can really process their feelings associated with a new diagnosis or some of the difficulties of having pain, that they can actually process that through art and we can get a story about it. So yeah, I use all different types of media. I have an art trolley and I go around bedside. So I have paint, clay, pastels, collage. So you try to use the child gets to choose what they want to do and then you direct the therapy around that. So thank you.
Thank you. That's a nice insight into what your daily work is with children using art therapy. Thank you. And then I've got Tom, Abdullah Tom. Hi.
Hi, thank you, Trish.
Tom is not in Qatar, so thank you for joining us from across the seas.
Of course, of course. Hi, everyone, and good evening. I think it is in Qatar at the moment. So I'm Abdullah Tom. I more commonly go by Tom, just because it's a lot easier. I'm a senior medical student at Qatar Medicine, Qatar. And my passion and interest in mental health mainly stems, I think, from 2 prior experiences, one of which was very personal and my own journey with mental illness. And the second was, I think, at a time, if you've asked me several years ago if I was interested in psychiatry, I would have been confused. But I think my main interest stemmed from this one day where I was supposed to be in the hospital and I was assigned to a completely different area in the hospital and just somehow ended up at the child and adolescent mental health clinic. And I absolutely fell in love. And I knew this is what I wanted to do for the rest of my life. And from there on kind of is where my journey began. Just to give you some backstory, I'm a third culture kid. I'm Sudanese, born and raised in the United Arab Emirates. And I'm very much interested in management and healthcare management and healthcare leadership. And I've always been kind of fascinated by the brain and mind, humanity and society, and how all of these link together. And I found exactly that in mental health and psychiatry. And that's why I hope to work towards integrating healthcare policy and mental health advocacy on national and international level. And just as a brief background, I have previously served as the president of the Medical Student Executive Council at Cornell, during which kind of ignited within me, again, that passion in mental health where I was tackling student burnout. And then later on, I served as the president of the Qatar Medical Students Association, which I work towards mental health and particularly tackling students in Qatar as a whole, and particularly healthcare professionals, because a lot of times people think that we, as healthcare professionals, we tend to put on this strong, brave face where we're not susceptible to mental illness, when in fact the data has shown that healthcare professionals are actually more susceptible to mental illness. And this is why I'm wearing scrubs today, to highlight the fact that we as healthcare professionals do go through that, do suffer from mental illness as well. And currently I'm actually serving as the International Federation of Medical Students Association as regional director for the Eastern Mediterranean region. And part of my work, again, is me tackling mental health in the region. I'm particularly passionate about global mental health. And that kind of have led me to working on mental health initiatives and improving access to mental health care back in Sudan. That started around the time of the Sudanese revolution, which I'm still working towards improving access to mental health care, making sure it's affordable, and advocating for equitable health. And I'm just generally very passionate about psychiatry, serving the community, and integrating different aspects of humanity and sociology into providing mental health care. So yeah, thank you.
Thank you, Tom. I'm seeing a little bit of a pattern because we've mentioned children a lot. So I think they're a very important aspect of what we might have to talk about today. Thank you so much. And then I'm welcoming Andy. Oh, hold on. Need to unmute yourself.
Hello, everyone.
Hi, Andy.
Hello, everyone. Ignore the background. I'm not being taken up by aliens. That's one thing. Right. Yeah, my background is I'm from the UK. My parents are from West Indies, Jamaica. I like working with children. Like Trish said, there's a pattern with what everyone's been talking about with children. I've worked with children for a number of years in various guises as a mentor, advocate, in football, sports, using sports as a tool to help children, young people, and adults. I've inspired thousands of children with confidence building and everything like that. I've worked with children with ADHD, picker, so many different health problems. I've done the works, to be honest, and now I'm here as a teacher, but I'd like to do more. I actually run a podcast to do with mental health, which I'm very passionate about. I've interviewed so many people from around the world, Australia. God, where am to interview? I mean, people from Africa, and the same thing. There's the same thing that happens. There's the same line. Everybody, we're all on the line of mental health. Is what tips us from one way to another on each day. And there's another thing as well. There's a stigma. There's still that stigma attached to mental health, which is what I'm finding in nearly every country. That's every person that I've interviewed to do with mental health. So I'm very passionate about it. I think spirituality was mentioned earlier, and I just want people. I think we've kind of come away from that connection of humans. We've kind of come away from that connection of togetherness. And I think it's important that we come back. And also one more thing is, when we spoke about children, is trauma. When I interviewed a lot of the people, they spoke about the trauma actually happens at a young age. Yes, it can happen when you're older, but it tends to happen with children at a young age. And then they take it into adulthood and they never really get over it until something happens. So that's my thing to do with mental health. Actually, I'm very passionate about it, and I hope that this talk can be talk of many, and we can open up the doors to kind of crush the stigma. Thank you.
Thank you, Andy. And I think stigma is something that, as you mentioned, I think will come up in our talk today. So thank you very much. Okay. So, Hamid. Assalamu alaikum.
Alaikum assalam wa rahmatullahi wa barakatuh. Good evening, all.
Good evening.
First of all, let me say I'm so pleased to be here with you. As you see, my name is Hamid Al-Qahtani. I'm an engineer at Qatar Petroleum. And my path crossed path with mental illness and mental health when I realized that there is a pattern in my life after I started working, that something is not clicking. And basically my supervisor was like, every time I do something wrong, that you have an issue. And this word, when he says you have an issue, it rhymes with me when I self-reflect with myself, that why I'm not able to achieve this, why I'm not able to do this. And then that's when my journey started, trying to seek help. And as Mr. Andy was saying, then that's when the stigma started hitting me in my face. I didn't find much support from some of my friends. I was actually doing this in secretive, I was like, okay, I'm parking in front of the clinic. I hope I don't know, none of here knows my car. My friends are not passing by. And I went through it, and alhamdulillah, me seeking help actually was allowed me to see the better potential that I have and to actually know my real passion, which is trying to make everyone happy and give them support and help. And slowly after not slowly, 2 years maybe after getting treatment, due to my therapist being so kind, she kept telling me to play with kinetic sand and clay to help release the stress and the anxiety. And then this started connecting me with flashbacks from my childhood, where I actually discovered that I really love to play with clay. So I took that and I pushed it 100% to test myself. So before, I wasn't able to achieve anything because I wasn't aware what I'm going through, how my brain is functioning. So I was like, I need to push with this one to see if I'm right. So if mental mental health is actually was what I needed to go. And alhamdulillah, I'm sitting right now in the middle of my office for my new business, which is Ceramic Cube, where I'm trying to provide, because it helped me. So I'm trying to provide to everyone the feeling, the capability that they can have something that they can reflect into, that is artistic and it's therapeutic at the same time. And at the same time, just trying to be supportive and make everyone happy as much as possible. Basically, that's the short version of my story. Thank you so much.
Shukran, thank you. And if I can just point out that your eyes lit up the more you spoke about play. So I think play is an important part of what maybe we can think about when we're discussing how we can connect with people in the community, and how mental illness is maybe seen as a very serious clinical aspect. And so we have got clinical people here, but we want to bring it more about what the community can access. So just a brief introduction about myself, because I'm not going to assume that everybody knows who I am. So my name's Trish. I'm an art therapist here in Qatar for the last 4 years. And prior to that, I was in the UK working in a very different way. So here I was working with substance misuse, addictions, and behavior disorders in a specific wellness hospital. So working in groups and individually. And in the UK, I was working in schools with children on the autistic spectrum, refugees, asylum seekers, working in holiday camps with looked after children, so many different areas. And I think my passion comes with just constantly trying to find ways to access people who need the support. So there's always a way, and I think that's what we'd like to discover a bit more today. So thank you again. So I'm going to ask the first burning question. Okay, so what do you think is more important about bringing awareness to Doha? What do you think we really need to, I know we've kind of hit on some of the things, which was stigma. Accessibility was a word that I heard being used quite a lot. So I'm wondering if we can explore that a little bit more. And I'm not expecting everyone to answer every question, so please feel free, if it's a burning one, to just let yourself know that you're going to talk, and then go for it. And then I will introduce others into. Thank you. So Hamid, I think you've put your hand up and you want to keep going. Okay.
So I just want to speak a little more about since we're starting, what's the limitations or what's the problem with the accessibility. I started my own awareness, basically campaign. Hopefully it's going to be a fledged on project, which is wuduh, Arabic for clarity, because when it comes to mental health in the region, it's not that we don't have all the resources. We just need to make it clear to the community that it's okay to seek mental health, hence the name wuduh. So we did a lot of research while establishing this project, and we came across so many things that is just quite daring to go with. A simple example is that we assume the scenario that someone is really depressed to the point that he's a risk for himself or maybe someone else, but he's aware and he's trying to seek help. So I was like, let's do this. Hello, I would like to get a therapist. No governmental method, like calling, trying to get help. And I have a profile. I'm a mental health patient at the end. So I have a profile and they have me registered, so they can look up everything. So they can say, yeah, this is serious, he might need some help, let's book him. Guess what happened? She's like, oh, sorry, you need another referral. So now we're talking about the system not being fitting. So she's like, you need to get a referral, and to get a referral, you need to go to the emergency. I'm not in a physical emergency. I feel in my brain, so as a mental patient, that I need someone to talk to right now. And to do this, I'll have to go to the emergency to see me, to be seen by a general doctor, that he will be like, okay, give him a referral, and then I can book an appointment. And from my perspective, this is just, this is so bad, because everywhere else you see there is hotlines, you see there is walk-in clinics, which we don't have here. Why? Because there isn't, from my perspective, I'm just gonna shortcut it, that because there isn't that much demand. Why there isn't that much demand? Because everyone is afraid of the stigma being attacking them. So that's from my side.
Thank you, Hamid. I think that's a really important factor here in Qatar, but I do wonder what it's like in everyone else's experiences. Chiming in.
Sorry, Trish, did you call me in there?
Yes, yeah.
sorry, I missed it. The sound went out. I was just going to raise something about. So what I've been lucky to be involved in is an initiative out of the States from Rosalind Carter, who is the former First Lady, the wife of President Carter, president who was president quite a while ago now, like in the late 70s, and she's still very active, and her passion is mental health. And her passion within mental health includes mental health journalism. And the reason I mention that is the importance of communication and the importance, we know the communication between people, but I think from a more formal level, the use of language, the way that stories are seen in the media, the way that people are portrayed in the media, to make it so that it is acceptable. I mean, I think what Hamid was just saying there, and seeing Hamid in a group like this, as a Qatari man, talking about issues that affect everybody, whether you are an Afghan man, Sudanese woman, Qatari man, an Englishman. This is just so helpful to see that in a public arena. And quite often the language that can be used can be really detrimental. It can be written about in a way where journalists are more care more about the story than about the people they're telling the story of, and allowing people to tell their story. And I think something we're working on at the moment is we're working with Northwestern journalists, Northwestern University journalism students, taking them over to the States. We have these sessions so that people do become advocates for mental health when they're writing about issues, when they're interviewing people who've been through different experiences, that they do actually consider the mental health aspect of things, and that they play a really major role in destigmatizing, in becoming advocates for mental health, and using this appropriate language. I mean, in some languages, I know we have some issues with. You can say in Arabic, there can be words that you might use for autism, for instance, which end up being, if you use the wrong word, it can be really detrimental. And I know in other languages as well, in Farsi, there can be terms that you could use which would be straight away put a stigma just by the language you're using. I just want to mention one other thing now. I mean, we're talking about community and being able to interact with each other. What has happened in these last 9-10 months due to the coronavirus, and us all being in this really weird situation where this is how we have community conversations now here in Qatar and around the world on the whole. I do think that from the sessions that I've been involved in, it has made everybody think more about their mental health. It has made people realize that this isn't just a niche area. It's something which affects so many people. Yes, there can be people who have a defined mental illness and who need support in that way. But for absolutely everybody, there are times when you have to think about your mental health. You have to think about your wellness. You have to think about how you interact with people, and that it's okay to not feel okay sometimes, and that, or for long amounts of time. And I think this weird situation, I hope out of this in a positive way, that this will mean that mental health is now on the table like it hasn't been before, and it is being discussed a lot more than it was before.
Thank you, Nick, and thanks for bringing in the examples from people going to other countries and coming back in and giving their experience. And I think talking about it from Hamid's point of view, also people in the public eye a little bit more, like you said, is really important to normalizing. But so I'm wondering what other people's responses to that would be. I know Michelle was ready to speak. Are you still wanting to respond?
Yeah, I'm happy to respond. I think it's interesting. When I've been working, one of my observations of working in a hospital is that Qatar culture is quite private. So I think it's one of those things that you have to honor the local culture, but sort of in gentle ways, like we're trying to build this establishment and build this infrastructure for mental health supports. So I know that for me, I've been thinking about I'm doing research projects in Qatar because you sort of experience the Western model. I'm originally from Australia, and there aren't as many services or specialized services for children or adolescents. So I think it's sort of like we're at that beginning stage that it's just getting it out into the community, promoting it through media. I always think the power of an art exhibition is always really great when people share their experiences and they have a story to go with their artwork, because I think that's really powerful, that everyone can understand the visual symbol and have that space to read about artwork and have those community projects. It would be really beneficial in Qatar, and I think a lot of people would respond to that. Yeah, so
thank you. And I think that's something that has been said when Nick was mentioning the exhibitions before, and Hamid has talked about his story as well. I think the story behind the person and the story behind what's going on is how we can relate. And as Nick said, you know, there's the language of technical language and things that can make it feel more stigma. So I'm wondering how we break those barriers down more. So thank you, Tom.
Thank you. I just wanted to highlight, I think
this is not, sorry, can you hear me? I just like for a minute. It's not just in particular with regards to Qatar, but I feel like this is more international when it comes to, we need a cultural change. There needs to be a lot of change across different parameters. There needs to be an institutionalized change when talking about mental illness, whether it being the way the services are being provided, whether it being how we discuss it in a more public setting, whether how it's viewed amongst the people. And partly where stigma itself a lot of times stems from the lack of proper public awareness and public education and the language that we use. For instance, interestingly enough, a few years ago, I was doing research into how language affects how epilepsy is being viewed and how it stigmatizes epilepsy. And in Korean language, just that year, the word describing epilepsy itself was changed because the original word actually caused more stigma and harm to patients rather than actually portraying epilepsy. And it's a matter of also for us talking about our experiences. So for instance, I have been very, very vocal about my journey with mental illness and the fact that I'm seeking help and the fact that I do see a therapist. Because one, Nick, I think as you mentioned as well, like the idea of representation and seeing people that look like you, that have been in similar situations as you, sharing their experience and showing people that it's okay, that there is no shame in seeking help, that it's something that we all go through, I think is very, very imperative. And it needs to be top down, down top, left to right, every possible direction for us to engage in that conversation. And what I think is also very important, and I've noticed this a lot, particularly within our region, is I think when it comes to talking about mental health and mental illness, is that we also need to integrate it with beliefs and the common beliefs in the region, because a lot of times people think it's more of lack of religiosity, whereas that can also be integrated, where we've seen a lot of times when it comes, for instance, when you're helping different people go through whatever they're going through at some point, integrating their own beliefs into their treatment plan, into their daily lives is actually something that does benefit them. But discounting mental illness to just attributing it to lack of religiosity a lot of times does more harm than good. So it's very important for us to be able to integrate different belief systems together as well. And it's very important to highlight that at the end of the day, when mental health is very much well-rounded and it takes into consideration a person as a whole, taking into consideration a lot of different parameters. So engaging and integrating that into the regular conversations that we have. And I think this platform within itself mirrors that conversation that we're having that needs to happen more often within our communities to be able to tackle that stigma, to be able to work towards public awareness, and to be able to work showing people that there's no shame and it's okay to seek help and it's okay not to feel okay.
Thank you. I think there's, we've just got, Andy, did you want to contribute anything on this one? Sorry, I don't want to take up too much time with my linking. Just
no, I do want to say something, because what I'm hearing is, particularly when Hamid spoke and he mentioned not being able to speak to anybody. That's one of the things that's come out when I've been tackling mental health and then working with children and young people over the years. You know, oh God, some of the things I've done with the gangs in Nottingham and in England, and you know, tackling gun crime and also all these sort of things. And one of the things that's come out is to do with men, and we as men don't open up. I know women get together and they'll have a chat. And I'm not saying mental health doesn't affect them, because it does, because as I've timed out in the podcast, it does. But particularly with men, where we're very enclosed, and we won't speak about our issues or our problems with another man, and maybe not with our partner, or you know, we just won't speak to anybody. So we'll keep it in. And then what happens then? It's a catalogue of things then happen. It affects your work, it affects your family life, it affects your relationships with your friends. So one of the things is very important, particularly in this region, is you know, and when I say this, when we say this region, it's almost like we're saying it's a new thing, because these things have been happening for years and years in other countries. You know, there's been wars, and you know, even in Ireland, where they had 30 years ago, where they had the problems there, and then now this massive fallout of that is generational. So now you've got a generation of people in Ireland that are committing suicide based on what's come from the past. I think if we can tackle things right now with open dialogue, a lot more platforms like this, I think we can stop that generational thing happening further along the line. You know, and working. You know, last year, I mean, I remember one of the children at school came up to me and spoke, you know, Qatari boy, and he said to me that, you know, his family had died. 3 members of his family's cousin had died in the weekend in, you know, at Sea Lion Beach. And I said, well, why don't you go and speak to the council at the school? And he said, no, I want to speak to you. And you know, and we had a conversation. His dad thanked me afterwards for, you know, for weeks and weeks of talking to him. He just didn't want to go and speak to. So again, it's that striking that fine balance of how do they open up, when do they open up, who do they open up to, and then how. What can we do here to help those openings and moving the children on? It's not about going to the doctors, going to Hamad Hospital, because they're not going to be people there who work with, you know, they're not going to be people there who work with mental health. You know, I mean, I've had it here where somebody's been to see a psychiatrist and they've just given them tablets and not listened to them. So it's a question of having people that they know that they can trust and that can open up to and talk to about whatever may be going off, or whatever's happening in their life. And I think that's very important, particularly, like I say, you know, us as men, something is really needed to tackle mental health, and as a place where people can go to where they feel safe, mainly safe, definitely safe, and they can open up to somebody and talk about their problems and not feel judged.
Thank you, and not feel judged. That last statement actually I think says it all, because just to kind of think about that, and something I talk a lot about when I'm doing my art therapy sessions, is the judgment. And we judge others, but our biggest critic is ourselves. So thinking about that, I think Hamid and you've all pointed to very important things, is we have the hotlines sometimes, we have the centres maybe, we have what the government is putting into place, because so much has been, I was reading all the statistics, so much has been put into place towards mental health. We have the Hamad conference, they talked about all the health centres, the forensic centres, there's more beds, everything's being put in there. But when you actually have to ask for help, it's that bridge, isn't it? It's that gap. and it's how it's welcomed. So the next question is, what sort of ideas and resources and what tips do you have for people out there right now who want to access some services, how to look after themselves if they're feeling that their mental health is feeling a bit fragile, or people that they know? I think from my experience, it's easy to talk about the other, but when it's within your own circle of friends, family, you can become frozen in knowing what to do. So I'd like to hear if anyone's got any examples that would be useful, very practical things. That's what we want to do today, is give some practical things of what we have got until those other things come into play. Thank you.
Trish, hello. I would say subtle, maybe not. Maybe it needs to be maybe it needs to be campaigns. It maybe needs something to let people know, because for me the biggest fallout of what's happening with the virus thing and all that, I think for me the biggest fallout is going to be mental health. And you know, we had it at the start of the you know, I think it was in April, someone had jumped from someone who committed suicide, you know, jumped in Italy. So, you know, literally early on, and we spoke about words, how words are so important and they're so powerful. So when we're using words like lockdown and just words like that, it can send a powerful message to people who are struggling with mental health. Because what that can mean is that, oh, they'll hear the word lockdown. Oh, I've got to go in. I've got to lock the door. I can't go anywhere. And then what happens is things start to think and start to read news. So I think maybe we need it just needs. I think there needs to be maybe a group or an organization or something where they come together as a group and put marketing or something out there, which isn't just like it isn't the thing where you help them for 6 weeks or whatever, and then that's the end of it. It should be a continuum, you know, thing that happens on a regular basis until, you know, rather than it a stop and start, or it's just a project just for 6 weeks and then that's the end of it. I think we need here. I think we need to let people know that if you are struggling, you need to if you can, open up and talk. I think the main thing is people might say, well, how do you get someone to talk? But if there's nothing to tell them to talk or no campaign to get them to talk, then they're not going to. So I think that's one of the things that we need to let people know that about men. There needs to be campaigns, advertising, marketing, whatever it may be, and organisations set up specifically for to help tackle various guises of mental health.
Thank you. Yeah, we're encouraged to talk, but where do we talk as well? Yeah, Nick. Yeah. Thank you.
So I think it's going to be slow. I think these things take time. It is going to be, if you're looking for awareness campaigns, it will take a period, and you will have people who go through the system and have a positive experience and share that and don't feel that they're going to be stigmatized by doing that. And of course, that takes a lot of time, but it also means you have to have those systems in place. Now, just trying to think out loud about some of the positive things here. There is now the 16000 hotline number that people are being encouraged to call if they have any sense of anxiety or they feel worried mental health around the current situation. So 16000. It's not just for physical health, that is meant to be a hotline for mental health as well. And there is WAYAC, the Mental Health Association here, primarily in Arabic. But I know a couple of the people there who do some really great work to support different communities. And again, we are one nation here, but we are within lots of different communities. And I know, for instance, Somali communities have some work that they do together. They're dealing with, and I think it was Abdullah who mentioned about the cultural thing of speaking to people's society, their language, their culture, their spirituality, and making people feel that they're safe in that environment. But aside from the systems that should absolutely be in place within the country and should be within the healthcare system, and they should be expanded, and they should be a major priority, and there should be pressure for that to happen. And I think there is increasingly. There are things you can do at home in this time around things like switching off from social media, switching off from fake news. By fake news, I mean, if something seems too sensational, if something feels like it's really going to worry you, it's been designed that way, and it is to kind of create that sense of worry and trauma. And if you Google, you will find things that will defend what you read there as well. Anything that you think of, you will find somebody to defend that. But look where that site is, look where their motivation is for putting that information out there. So take comfort in having some time away from that. There are, I mean, I know, again, I'll raise the fact that we have art therapists here with us, but beyond the therapy, just the things you do yourself. Hamid's talking about the working with clay, finding those things that can take away the buzz and the noise around you that can be very disorientating, particularly at this point. It can be really good. I plan to relearn the piano. I haven't done it for ages. I keep planning to do it. I still plan, and I will one day do that as my own way of absorbing myself in that. My boss at Wish, she writes fantasy short stories as a way to take herself out of some of the things that cause us stress. But I mean, there are things you can do, but I also think, yeah, there has to be systems out there, and we do need to make it so that people are able to reach those hotlines, and that if they feel safe reaching those hotlines, and that they're not going to be putting themselves in a bad situation by admitting to the mental health issues that so many of us have so much of the time.
Thank you, Nick. I'm going to come to Hamid. I just wanted to point out, thanks for sharing that helpline, but just to know that it's only from 7 a.m. to 10 p.m. So it is accessible, but only during those times. But thank you for sharing it. It's important. Hamid, I'm getting used to the virtual hands up. I'm so sorry earlier. I think I missed a few people.
That's okay. All right. So the first thing I want to say, why did they have to wait for this epidemic to put a hotline? Mr. Nick was speaking about WIAC. I actually had the courtesy to meet the president or the head of the Mental Health Association, Mr. Mohammed Ibn Ali, and we discussed all the issues regarding mental health in Qatar. And one of it that they are carrying in their back all the load of people who don't want to get an appointment, but they just want to get some help. And he's saying we're overloaded and it's not enough. So why there isn't a hotline from the what do you call it? Mental health? No, from Hamad Health Association itself, or the corporation. So that's it for my comment on that. But since we're talking about mental health and how to deal with it, I'm gonna talk as someone who's dealing with it. Okay, it all depends on the severity of what you're going through or how you're feeling and how long it's been going. So what I do is I rate this, and based on it, I have my own remedies, let's say. So something might be like, I heard something from a friend that caused me to feel unpleasant and it triggered something. So I'll be like, okay, maybe I should take some tea or coffee, whatever I feel, and just drive around before going to my next thing, whether it's going to my family, going to doing business. This way I'm de-stressing what happened so that my mental condition is back in the operational limits that allow me to give my best. But sometimes I'll be feeling unwell for a few 3 days. Here, I need to become an investigator. I need to do, usually I carry on with CBT, cognitive behavioral therapy. And I try to look across all the things that happen that might trigger something that's causing this dilemma I'm going through. And most likely it is one of the things I come up with, and just then I have to figure it out. If it's something I didn't do that I wanted to do really bad, and I said no, but okay, I'll go back and do it. Is it something that I said to someone and made me feel bad about it? Okay, go and say sorry to that person. If it's the thing, you'll feel better straight away. So I try to eliminate all of these. when it reaches the maximum, then, and I don't know what I do, then I'll try to book an appointment. And alhamdulillah, I haven't had the feeling or the urge to book an appointment with a therapist for 2 years. So I'm really happy. So that's what I'm trying to say, is that anything we go through or we feel, it can be rectified most of the time if we actually look back and trace what we did and how our emotions and feeling changed based on every action that we went through in our daily life. Thank you.
Thank you. Just also wanted to bounce off what Hamid just said as well when it comes to regarding severity before I delve into my answer, and just something to keep in mind. When at times things can build up and it can become really severe, where it gets to a point where someone is expressing suicidal ideation, for example. If that is the case, it's also very important to go to the emergency room to be able to get help. And that's the current system that is in place with regards to that. So I just wanted to point that out. But I think what's very, very important is if you are someone whose loved one is hurting, a lot of times just showing them that you're there for them, that you're there to support them, that you would not judge them, that you're there to listen, that you're there to support in any way that you can, that can come a very, very long way. Sometimes for you, it can seem just like a conversation or a text that, hey, I'm here for you, but it can mean the world for the person at the other end and the person that's receiving it. And back to what Andy has also said, it's very, very important to highlight that it's a completely judge-free zone. You're not there to judge them. You're not there to criticize their actions, rather than you're there to be able to help and support them to what they're going through. If on the other hand, you're someone who is suffering, I think it's very important a lot of times is to be true to yourself. Again, it's easier said than done, but it is very important to be true to yourself. Do recognize what does make you happy, what things affect your mood, and be able to kind of distance yourself from things that bring you down. It does require a lot of self-reflection and a lot of practice to be able to pinpoint these things, but it does come with a lot of help moving further down the line. And what's one of the main challenges that I've seen when it comes to accessing mental health is accessibility and affordability in particular. And that's a very, very big issue that a lot of people tend to deal with. And when it comes to talking about accessibility and affordability, I think some of the solutions that do exist, for example, if you're a university student, most universities, if not all of them in Qatar, do have psychologists on campus that you can always refer to. If you're not a university student, there are actually virtual mental health professionals that you can book appointments with, where you can engage in things such as cognitive behavioral therapy, get trained in that. And the beauty of telehealth, not only is it affordable, but at the same time, it uses telehealth services where it's at the comfort of your own house, of your own room, your own private space. And again, that goes back to stigma. And for example, what Hamid mentioned earlier, if I'm parking my car here, is anyone going to recognize my car? And for a lot of people, that's a big concern as well. So the beauty of telehealth is that it allows you to engage in mental with professionals in the comfort of your own house, the comfort of your own private space, and where you feel most comfortable. And a lot of times, look at the people around you as well, people that you can trust, people that you can talk to, and people around you within the community that you know would be there to listen, and that you can always just go give them a call, grab a cup of coffee, and just go on a rant if you need to, and do what's right for you. And that's what's so important. When you're, at least for me, for example, when I'm feeling down, a lot of times I feel like I'm weighing down on somebody else by talking to somebody, or that I'm overstepping my boundaries. But on the contrary, a lot of the people around you are there to help you. And from just speaking from personal experience, it took a lot of active effort to convince myself that no, I'm not being a burden on them, rather than they're trying to help me to go through whatever I'm going through at the moment. And it's very, very important to recognize. And a lot of times that comes through pushing yourself, thinking out of the box, and putting yourself out there. Being vulnerable, there's nothing wrong with being vulnerable. There's nothing wrong with showing emotions, whether you're a guy, you're a girl, regardless of what ethnicity, your background, it does not matter. Because at the end of the day, each and every single one of us goes through it. And even if people try to deny it, I mean, they have gone through it at one point or another. So I think that's very, very important to just create that culture and that safe space around others.
Thank you. Thank you, Tom. I know Hamid's got his hand up, so I'm going to go to Hamid. He's had his hand up for a while.
No, sorry. I don't know if I did it by mistake or I was just.
Okay. So Andy's got his hand up. Okay. I've got virtual and physical hands. I'm trying to navigate. So thank you. So Andy,
I'm just going to chime in there. Just keep it short with this one, because what everyone's saying there is what the main thing is. What everyone's saying is, which is something again I touch upon on when I'm working with people and young people, and I've done through the years, and what I've heard on the podcast is coping mechanisms. I mean, everyone said it on the said it just now. Is what do we do to cope? As someone just said it there, then a support network is very important, because don't forget we've also got people here who are in Qatar that may be living on their own, who have come from a different country and are living here on their own, or even people from here that live on their own, and people who have got maybe have so many kids and the kids run around and then they're struggling with lots of different things. So coping mechanisms is definitely an important thing, because I always use this analogy on the podcast is when I'm speaking to someone there, I'll say that a drummer will go and as part of their coping mechanism, they'll go and get on the drums and start smashing the drums, and that's one of their coping mechanisms. And it's about particularly with children and young people and even adults, it's about letting them know what is your coping mechanism. What do you like? What do you enjoy? Whether it's art, painting, for an adult or whatever, you can go and I'm not very good at it. But so what? What do you mean you're not good at it? Just paint. Put a paint. Draw, or and I think once you give them that encouragement and that support, like I say, the two things, coping mechanisms and support mechanism, I think those things are the main things to help with people who are struggling with mental health. And once we can do that, because we have mechanisms for other things. We have, if someone breaks a leg, that's the support mechanism is they can go to the hospital and maybe get it fixed or whatever. And then, whatever happens from that, physiotherapy. So we definitely need a support mechanism going along the way. And as someone spoke earlier and said that obviously it's going to take time. But I think while we're talking about it now, the time is now. So yeah.
Thank you. I just want to bridge something very quickly that Tom was talking about that might come into this. And of course, with COVID, I don't want to bring COVID into it too much, but it's actually projected us into the online support, which might have been actually quite helpful for a lot of people to have that virtual access within their own homes. I know a lot of therapists that have had to continue with that and found it quite helpful, even back down to WhatsApp messages. So it's kind of, I think, how we look at mental health support was very westernized and very, clinical, but now we're allowing ourselves to be more accessible. I think that's my experience at the moment. So I just want to quickly say to any of the attendees, if you want to ask any questions, please use the question and answer or the chat. I wonder if we can just take one or two questions because we're at nearly 7 o'clock. Is it okay if I take one or two questions from the question and answers? So I'll take the first one that we had from, so we've got a question towards Hamid and the rest of the panel. According to what Hamid mentioned regarding the accessibility for mental health services, what do we have to do in order to improve the system? Very big question. I think that's exhaustive, because I'm going to leave it to you. So that's one of the questions. I can ask a few more if there feels. So another question we have is how people can have an appropriate healthcare during the pandemic, especially with some countries back to lockdown.
Sorry, Trish, could you please repeat that? That was more about healthcare, not mental health.
So I think it's how can people have appropriate healthcare? So I think it's maybe mental health care during the pandemic. some countries are back to lockdown. So I think it's, again, talking about that, but I'd like to link that a little bit with another question that was brought up to do with language, and you know, the word lockdown is very oppressive. So trying to think about how we can use language in the Middle East to reduce stigma. So I'm kind of trying to combine those two because they came up in a similar way. Would anyone want to? Yeah, Tom, thanks.
I can jump in and just share a couple of thoughts.
Mm-hmm.
I think so. For one, when it comes to access to mental health care, as I've mentioned, this telehealth has been booming recently, especially like during the past couple of months with regards to during the pandemic. And there's been a lot of more. So one of the main issues in the past that have been with mental health is the perception of physicians with regards to mental health, as well as the perception of the general public with regards to telehealth, as well as the perception of the general public with regards to telehealth. And I think one of the main things that the pandemic has shown us that even though that it's not your classical way of seeing a therapist or accessing any sort of healthcare, it has still proved to be a very, very efficient method for people to access healthcare. And actually, there's been a lot more, in my opinion, pros than cons to telehealth, because it gives you the opportunity a lot of times. So like there are a lot of phone applications that people have been using to access mental health services. People hop onto on a Zoom call with their therapist and so forth. So it's been a lot more easily and a lot more accessible. With regards to other question, when it comes to the language, I think as what was previously mentioned, what's so important is that we need to be very cognizant of the words that we use, particularly right now during the pandemic, because there are a lot of words that seem to be a lot more aggressive, and it can have an impact whether consciously or subconsciously. For example, at the start of the pandemic, when the most frequently used word was social distancing, the Secretary General of the WHO had a release at the time that is like, let's shift from using the word social distance to using physical distance instead. Because yes, we can be physically distant does not mean being socially distant. We can hop on a Zoom call and play a bunch of board games together. We can hang out while maintaining 6 feet apart, 2 meters away. It's not a matter of social distancing, but rather physical distance to protect yourself. Words like being in complete lockdown can be shifted to other words, even like words like quarantine. Because the way that we're trying to portray is the fact that you need to take your own healthcare into your own hands. And the words that are currently being used make it seem like these things are being forced onto you, rather than you being encouraged to abide by physical distancing, staying at home, and so forth. And a lot of times we tend to go against what people tell us to do. For a lot of people, that's natural. So I think it's very important the way that we portray the message of taking your own healthcare into your own hands, protecting yourself, protecting your community, protecting the ones around you, protecting your loved ones. The way that we phrase that language, I think, is crucial, because one way or another, it can impact your mental health. And I think a lot of times for a lot of us, the impact is more subconscious. So yeah.
Thank you. And Nick shot his hand up at that point, so I think there's a burning response.
As Tom just said about the changing it from social distancing to physical distancing. I mean, if we're going to be a little bit briefly technical, it's all about practicing cognitive reframing. So it's changing the way that you use language yourself in order to have a different perception of what's going on. So you're not stuck at home, you're safe at home. You're not, if you're in lockdown, then you're safe. You could say, I miss the things I love. Or you could look at it as effectively, I have much more gratitude now for the things that I love, a much greater appreciation for the things I love. And, my friends and I can't see each other, but actually my friends and I are protecting each other. So some of these things can be used in the way you reframe it. And going on to the holistic side of things, there are things that you can do. I mean, just for the other question, which was about within COVID-19, how can we be healthier? And mental health is so connected to eating healthily, exercising, be that exercising around your own home, doing something in your own home, doing some skips, I don't know, whatever you can possibly do. Not being too hard on yourself. Actually, if you don't succeed with everything you want to do every day. That's okay. People do have kids running around screaming, or you could be really low that day. I think what Hamid was saying about finding your own coping, giving yourself a little bit of time, giving yourself that space to do that. The technology side of things, I know there are people like Talkspace we've worked with in the past who have these online therapists that you can have that sense of almost dipping your toe into therapy without having your car outside and people going, what are they doing in there? Not that there should be any shame about saying that. It should be, you know, what they're doing in there is sorting things out. They're taking care of themselves. What's wrong with that? I think there are definitely things that you can do, and we should all remember that some of those things are in our control.
I think it's also important to acknowledge how long this pandemic is going to go on for. So I think, like, you know, I don't know if endurance is the right word, but I think we're not going to get over it easily. So I think it's like, as you said, like have those things, have those creative outlets like cooking, gardening. I know even just going to an art gallery is very therapeutic for me, that it gives me looking at artwork and having that history. And sort of learning new things. So I think it obviously we're from an arts background, but it's also having those off hobbies that improve your quality of life. I think that's a big thing that we should bring from this, that, yeah, as you said, we're not stuck at home. You sort of like appreciate the small things and take pride in your home. Like.
Thank you. I've got another question here about, as someone who's benefited tremendously from mental health care and treatment, I would love to know if any of the panelists know of opportunities to engage in volunteer work here in Qatar. Also, what are some strategies we can use to encourage others to take care of mental health in our day-to-day life? Apologies. Oh no, I think it's just about the way it's written. So something about how to engage in volunteering, and about how to strategies to help people talk to their friends or people they love about mental health. Okay, Michelle.
I was just going to say, there's a really good website, Are You Okay? I don't know if anyone's heard of it. And that sort of gives people phrases. It really highlights giving them a safe space to talk, not to be judgmental, but you don't actually have to fix their problem. A lot of people are coming to you for support and to hear that it's not your responsibility, and sort of to be with that person on that equal level. So that website has a lot of good resources, like even like phrases that you could use if your friend or loved one is struggling with mental health issues.
Thank you. And I think that's one of what I was talking about before, is it's difficult. It's easy until it happens, I think, and then you feel maybe a bit stuck. So that's really lovely to know there's resources out there. I'll go on to another question. Oh, the volunteering. Has anyone got any ideas on that? I know from my experience, there's a few voluntary sections, and some people have come to me about volunteering. It's not always easy in Qatar to find that information. So there's a couple. Nick said yes. Thank you.
Yeah, I think WAYAC, we mentioned them before, but WAYAC, and in fact Hamid said they carry a lot of weight, and a lot of what they do is done through volunteers. So if people do want to volunteer, then there's a lot of work there. And I know that we've been involved in some of the training sessions for volunteers. So you can volunteer and also get some training in helplines and things like that.
I muted myself. So thank you. Anyone else have any other ideas about volunteer work? I think just to give something about volunteer work, I'm glad somebody asked about that. I think one of the things that is interesting is that it's kind of a deflection, but if you're doing something that helps somebody else, it kind of helps you have some perspective. And I wonder if, Hamid, that's something that you experienced by creating the, I can't remember the name of the space now, but creating the business and then feeling that you were providing something in another way. I guess volunteer work does have that aspect where you're not just thinking about yourself, and we call it navel gazing, looking in, looking out a little bit more.
Yeah, that's true. Basically, what we did is that at the beginning, my perspective, it's called wuduh, WUDWOH, wuduh, clarity, to show you a clearer path, your path to clarity. That's hopefully our slogan once we go full end. So wuduh, which is your path to clarity. We at the beginning we were thinking just a bit small, Qatar, JCC. But then I discussed with my team, with the co-founders as well, and we're like, why are we just looking at the Gulf or Qatar? Let's just go global. And that is when we hit jackpot. Our Instagram account went from just having little over 400 followers all the way to 3,000 just in one campaign across all the Middle East, Egypt, Lebanon, Jordan, Syria, Iraq, Tunisia, Morocco. And then everyone who was suffering from the same thing just went in. And I was like, I'm so happy that there is all this much of people trying to reach out and actually find. So the feeling was beyond amazing for me. Yeah.
Anyone else would like to respond? Yeah, Andy, I was just wondering. Yeah, carry on. Thank you, Andy.
Yeah, I'm just listening to everybody, and I'm glad Hamid's here and everyone else is here, that his story, because what can happen is when you've gone through something and you've gone through depression, or if you've gone through suicidal thought, whatever you've gone through mental health, and you've hit rock bottom, and then you start to make your way back up. What can happen is you do actually do things long term to help others, and I think it's about giving back. And once we recognize that we're all on this planet together, and we should be here to help others and give back to others, and I want to say should, I don't force it on people, but I think it's important that the people we've gone, I've been through things, we've all been through things, and one of my drive has always been to help people. I just help people all the time. Help people with advice, whether it's, and even, we spoke earlier about the sports, doing coping mechanism, and also doing sports as an opportunity, like say from your house, do some exercises. We talked about painting, we talked about baking, we talked about so many coping mechanisms, banging the drum. But I think, it's important that we then look and think, oh, well, what can we give back? What can we do to help others who are maybe going through things?
Thank you. I think that links very, Nick, carry on. And I'm just going to ask this question so that it's out there. We have another question which links to that, about reaching out to schools, and can I have the students create campaigns, organize workshops in schools, in the museums, and kiosks in the mall. So that could be linked into the voluntary, the feeding back, the linking in. Thank you.
So I'll be really quick on this. I will mention on that, somebody else will have a better view of that than me, but yeah, that's the amount of empowerment you can get from the younger generation, who can kind of take messages back home and normalize things is great, of course. But it was just picking up on something Hamid said about his wuduh campaign. I hope I said that vaguely okay. I've written down the spelling at least, thanks. Of reaching out in social media, and it just reminds me that, and I can see somebody's asked about social media in one of the questions, that social media can be overwhelming. You can find very negative things, but there can be some great support groups. There's a long COVID support group for people who are suffering from issues, and there are lots of really strong groups out there that you can dip in and out of. But I've also noticed from some work we were doing with people in Kuwait that social media has also proved to be a great way to deal with things, and it's not directly connected, but I think it gives an idea in case of stigma. There's a great account of a doctor in Kuwait who deals with people who are having infertility issues, and particularly men who are concerned about that, who by using social media and the messages he puts out there, he's kind of being a face of somebody that people can connect with. It humanizes that, but it also means that he's able to form a bridge and get a community and get thoughts out there. So hearing what's happening with Wudu, I hope that really grows, because that does seem to be somewhere where if you can create these spaces in social media, if you can use social media as a force for good rather than some of the more negative aspects, then that would be really great in the region.
Thank you. I'm just keeping an eye on the time. We've got 15 minutes left. We've got one question here about support team supply companies. I think what the panelists is, the attendees asking is about support for companies, perhaps. Mental health support. How do we support people at work?
So within, I'm a child life art therapist, but I sit within a child life team. And so we've done weekly drop-in sessions, online sessions, just for half an hour. And that has been a really great way to sort of process or to look after our own self-care and mental health during this time. So we get, people can get to teaching new skills. So like, you've learned how to make glitter jars, glitter shaker jars, yoga, we've done a dance class. So you can think of like free, I think we have to think of maybe potentially free options. There's a lot of things online for resources, like, so we had a colouring in day. It's sort of being creative, how you use your time. Yeah.
So it sounds a bit like skill sharing. Yeah. There's one thing that I wanted to just bring in myself, which I think has stuck with me quite a lot, especially with the recent, we've had the mental health awareness for Alzheimer's. So we've talked very much about the younger generation, we're talking about online, we're talking about all these different ways to connect. And we've got the other end of the spectrum as well. And I wonder if there's any thoughts of that, and then we'll go into the closing.
I can say there's a lot of arts and health research with seniors. They're a huge area at the moment. So they were just saying how it's really helping art, like painting, pottery is really helping seniors maintain their quality of life and their problem solving skills. So I think that's a developing field, and I think potentially looking for options, and guitar would be amazing.
Does anyone have a response to the older population in Qatar? I mean, culturally and accessibility is the two things that we've been talking about today. So I wonder if there's any responses for how we make things accessible and culturally appropriate. Heath, thank you.
All right, so for all population here in Qatar, I think what's going on with difference to more developed countries like in America or Europe, that we are going with modernization really rapidly in the last 20 years, which was happening the previous 20 years in the other countries. So we are not able to catch up. And I've seen some initiatives that are trying to help with that, which is, for example, an association called Ihsan, which is basically to look after the elderly, to provide them with outdoor areas to go and meet and walk around. But still, I think that for them and for even the younger generation, we still need to have more access. For example, in our healthcare centers, you would find the throat and ear specialist there, the X-ray specialist, a pharmaceutical. But if you need to get into a therapist or a psychologist, you'll have to go to the main emergency, not even the emergency inside the health clinic center. No, to Hamad main hospital emergency, and then you get a referral that takes you to the psychiatry hospital. And that's the only way to get it in, inside the governmental structure. Of course, in private, it's available. But still, I think that's what we need. We need to normalize and make it available so that once it's available and easily accessible, then people are going to think less of it as a stigma and more or less as the usual routine, just like you're going for a physical checkup.
Thank you. And Tom?
I think as well, like tackling this from a more, as I said earlier, like public awareness and public education across different levels within our society, starting from schools, because even like data has shown that about 75% of cases of mental illness tend to begin before the age of 24. So tackling this during middle school, high school, during universities, having classes, awareness, and not just to the students, but to the faculty themselves, to the people that are working with those students, tackling this amongst company cultures and within different organizations and different structures. And there needs to be a lot of emphasis on public education. And one of the things as well that I would have loved to see, and I've seen in other parts of the world as well, like when it comes to, for instance, integration with belief and religiosity, is that, for instance, like during Friday prayer that's attended by a lot of people, sometimes the khutbah itself, or like during Friday prayer, I've seen a few times where it actually ended up talking about mental health. So that integration and showing people that, because a lot of times people just think, you know, it's just a matter of lack of religiosity. And I've seen that, for instance, within my own family. And this is where it's very important to come in, where if you're comfortable to talk about your experience, because I have seen the change firsthand amongst my family members, where at some point when I first started talking about it, the perception was, oh, you need to start praying more, you need to start reading more, and that was their approach. But then over time, as I was talking more about it, so at some point I was away because my family's in the UAE, but during the times that I did go back home and they saw the physical manifestation of how mental illness was on me, not only did their perception change, but engaging in that conversation also changed their own view. And so one of my siblings has a podcast, and during that podcast, I was once listening to one of his episodes on my way to the hospital, and they started talking about stress and anxiety, and he said that if it wasn't for Aboudi, I don't think I would have ever been able to be in a position where I can openly talk about my own experience with anxiety, because he's been badgering us at home and just constantly talking about mental health, mental illness. And if it wasn't for that, I don't think we would have been in a position where we notice that it's okay. Like, we've all gone through it. And I think just engaging in that conversation is very important. And it can seem like it can start from this small community that's around you. It can start by your friends, your family, and then later on begin to expand. So yeah.
Thank you. I think that sort of trickles into perhaps what we've all trying to come to today in these discussions, is that we've got to find something in the community, and how do we get it there, and how do we put it there? And are we thinking of a physical building? Are we thinking of a community network? How does everybody see it happening? And I think that's where it's going to take a long time, and I think it has to be in all of those areas. I think it has to be in buildings, it has to be in communities, it has to be in places where people gather, and it's not necessarily that we're coming to talk about mental health. We're gathering, we're connecting, socially distancing, physical distancing. But I think the main thing that I've heard, and I know that usually comes, is that connection is really important. We need to find a way to connect and to make things normal. So I'm just going to quickly have a look at some more questions. Excuse my furrowed brow. Someone said workplace therapy is so needed. My teacher colleagues and I are at the point of imploding. We are working so hard trying to deliver online lessons, and we're getting so much negativity. So we've got, I'd say, about 2 minutes to answer that one, and then I'll round up, which doesn't feel fair. I mean, this is the thing. I think this is just a discussion we're starting, but I am very drawn to the word that imploding, because it's not exploding, it's going in. So if anyone has a response to that, the teachers that are really feeling this.
I would say there's a lot of expectation, or probably too much expectation, based on what's happened. Like I said, the teachers are feeling it. The teachers, like everybody else, were in this thing, what we call lockdown, or whatever you want to call it, inside for many months. Some of them didn't leave the house or leave their apartments for many months, had things delivered. And so there's a lot of expectation on teachers to deliver something that they've never done before. And that's definitely needed. It's definitely needed that people they need counsellors. Counsellors are needed to help, not just to help the children, but also to help the parents as well as the teachers. And I think, like you said, Trish, I think there needs to be all those things. It needs to be drop-in centres. It needs to be a community. It needs to, even if you met somebody on the park to have a chat with them, and it doesn't have to be around what they may be going through. It may be something that they may just need someone to talk to. I think those things are very important. But yes, it's definitely needed that we, teachers and people in jobs, people who may be going through struggles in the jobs and the workplaces, putting pressure on them. Even before this, Hamid mentioned that, why is it taking until now? Maybe nothing happens before its time, but it's definitely something that we need to be looking at going forward.
Thank you. And I think Hamid, yes.
Okay, so I'm not a therapist or a certified psychologist, but I'll give you as a patient what I do. I realize that most of the time the negative energy, because she's saying, or he's saying, that there is a huge amount of negativity coming because they're doing online session, and I see it because I have a lot of nephews and nieces, and they're like, I hate this, I don't want to do this. So usually what I would do, you need to understand these feelings, these emotions are not towards you, they are just generated due to something, and they are being forced and they're being targeted at you. So you as a teacher, it's not your fault, you're trying to do the best because that's what you've been told. For them as students, they don't like it because they're like, either we go there or we don't. So they are angry at the governmental orders or the structure, how things are going. And the only thing they can do is unleash it at you because you are in a social distance. You're not gonna see how frustrated they are. You cannot hit them or tell them, I see you said that. So, and they cannot do it to your family. So that's what I do. And I learned this through learning it from my kids. For example, if my daughter is not behaving, I'll be like trying to analyze, okay, you're upset, I said, I'll take you out yesterday and I didn't. She's like, yes. I was like, okay, sorry, I'll do it. And this helps. Basically, I'm trying to say, put yourself a bit further, like distance yourself emotionally from what's going on, observe it, and then you will know that this is not because of you or what you're doing, and it's gonna help you actually perform what you're trying to do much easier without much feeling the load of negativity on your shoulders. I hope this makes sense. Thank you.
Thank you so much. So we've got 3 minutes, and I'm just going to go very quickly and say thank you so much to everybody. I'm sure we could have gone on so much longer. The questions were coming in. There's one question very quickly. Medical student wants to know how to avoid burnout. So very quickly, Tom, and then thank you, everybody.
For me, I think burnout is a very, very big topic that I can go on for a long time talking about it, but I'm going to try to keep this brief and mainly talk about my experience. And I think there was a point where I was completely burnt out and, in my opinion, have hit rock bottom at the time. And one of the main things that really, really did help me personally was therapy. And it's not just therapy when you're feeling down, but I've decided to like regularly do CBT with my therapist. And that's something that I've been doing quite regularly. And that's whether I'm feeling well, whether I'm not feeling well, just that constant therapy sessions like every week, every other week. It really did keep me going, and it was very, very, very helpful. 2, I think the support of my family and friends and the people around me, and just having that supportive community around me has been tremendously amazing sort of support that has helped a lot. And knowing my limits and knowing what makes me happy, and knowing that at times I do need to distance myself. And I previously used to frame it as I'm being selfish by prioritizing my own mental health, but rather it's not a matter of being selfish, it's a matter of being self-sustained. So there's been a lot of times where I prioritize myself, know what's good for me, what's not, and just do that.
Okay, thank you. That draws me very quickly to the end of this, and that's, I think, a good point. You need to look after yourself before you can look after others. I'd like to say thank you to you all for coming and meeting today and talking about some really important points. I hope we can meet again another time, and thank you all very much. Look after yourselves, look after your thoughts, and take care. Okay.
Thank you.
Thank you so much.
Thank you, CC The Works, for organising this.
Yeah, and thank you, CC The Works, for all the technical bits. Yes.
Yeah, thank you all. wish you all the best.
It was a
Thank
pleasure.
you. Yeah. And if anyone wants any questions, I'm sure that we can cross-link people if that needs to be. It was very short to get everybody in. But thank you so much. And thank you to the attendees for coming and sharing your questions and time. Okay.
Thanks.
Thank you. I don't know who logs anyone off.
We
Nice
do.
to meet you.
Thank you, everybody. Bye.
Bye.
Bye. Thank you.
Okay. So thanks, everyone. I hope we see each other again soon. It's been nice to see familiar faces, and Hamid, it was really nice to meet you for the first time.
Pleasure to meet you as well.
We'll be popping down
Yes.
to use the
Inshallah.
ceramics. Yeah, inshallah. Shukran. Thanks, everyone. Have a nice evening. Take care.